Hi, I'm Leigh Horne-Mebel, and I'm a clinical social worker with the Sunflower Syndrome program at Massachusetts General Hospital. And I'm happy to talk with you today about some of the mental health issues that Sunflower Syndrome patients experience, primarily that of anxiety. When patients first come see us in our program, they usually have been on a long journey of trying to find specialists who know about their symptoms and how to treat them. They have most often been referred to psychiatry due to concerns that they have a psychiatric disorder, or they have been referred to see behavioral interventionists with regard to preventing their hand waving. Some patients have even been placed on behavior plans to prevent the hand waving. All of this can greatly impact daily living for our patients. In fact, our program conducted a recent study and found that 65% of respondents felt their daily life was greatly impacted by symptoms of sunflower syndrome. These circumstances can clearly leave one feeling that no one understands them, invalidates their feelings of their experience of trying to access medical help, or knows what their symptoms represent and how they are being impacted. The result can cause one to feel anxious and possibly depressed. In the study I just mentioned, we found that 69% of respondents described themselves as anxious and depressed. So anxiety is the most common mental health issue that we see in our sunflower patients, and that is what I'll focus on here today. There are a number of types of anxiety, and here is a list of them. For the purposes of this presentation, I'm only going to focus on the types we see most. Also, our colleague and psychiatrist, Dr. Erica Greenberg, will be talking with you specifically about obsessive compulsive disorder. So please be sure to look for her talk. So on our list are agoraphobia, specific phobias, separation anxiety, social anxiety, panic disorder, selective mutism, generalized anxiety disorder, and OCD, obsessive compulsive disorder. Specific phobias, just to go back onto the top of this list, is something that we sometimes do see in patients. It's a specific phobia about sometimes like an animal, a fear of spiders or something like that, or of needles, or coming to the hospital, or having lab work done. So those could be specific phobias. Panic disorder is also inclusive of panic attacks. We might sometimes see that. Selective mutism, we very rarely see. I just wanted to give a little bit of a mention to some of those that I'm not going to focus on today. So separation anxiety is a common type of anxiety seen most often in younger children. It's usually thought of as a fear or a worry about being separated from an attachment figure, such as a parent, a grandparent, or whoever the primary caregiver is of the patient. It's usually thought of as a fear that something is going to happen to either the patient in the absence of the caregiver, or something, or a fear that something is going to happen to the caregiver during the separation. This is a type of anxiety that can often lead to somatic symptoms. And by somatic symptoms, we're talking about symptoms that are not physically real, but are imagined. So that could include things like headaches, or stomach aches, or muscle aches, those kinds of things. Social anxiety is also something that we see a lot of. Social anxiety is where there's a fear of being, or a worry of being negatively critiqued or judged by others, especially others who might be of significance to the patient. It can also even include a worry about being negatively perceived by people who are in a close friend group. Social anxiety is something, by the way, that we've seen a little bit more of since the pandemic in the general population of children, and also that we treat, and also specifically to patients who have Sunflower Syndrome. So generalized anxiety disorder is what we most often see. Um, Generalized anxiety disorder is characterized by a concern and worry about present and future events. It can greatly impact daily living by affecting things like appetite and sleep. It can cause an increase in appetite. It can cause a decrease in appetite. It can cause an increase in sleep issues. It can cause insomnia. It can also cause an increase in social isolation. It can cause an increase in the chance of depression with persistent sadness, with persistent irritability. Oftentimes when someone has generalized anxiety disorder, they have a frequent request for reassurance, or they give an indication to you that they need frequent reassurance about who they are, about what they're doing, about them being okay, what they're doing being okay. They usually have lower self-esteem, and so they often can need a bit more reassurance. So generalized anxiety disorder is something, of course, we want to define a little bit more than just the description I just offered. So when we think about generalized anxiety disorder, we're thinking about a couple of things. We're thinking about a persistent and intense worry about the future or present events, like a test this afternoon, or something that's expected to happen over the weekend or in the next few weeks. This is the type of anxiety that can cause negative behaviors, such as overeating, or such as an increase in impatience, maybe an increase in temper tantrums or bad temper. It can also cause something that we call distorted thinking, which is black and white thinking, either or thinking, catastrophizing. Teens are very prone to catastrophizing, especially when they're feeling very anxious. And another type of distorted thinking is mind reading. The person thinks that they know what people are thinking or what they think about them and those kinds of things, and then they act accordingly. So the Diagnostic and Statistical Manual of Mental Disorders that we use to diagnose patients tells us that three things need to be present: that there needs to be this intense and persistent worry that is not alleviated and is present more days than not for at least a period of 6 months. The second thing that's required is that the person feels that they're not able on their own to manage their worries. And the third thing is that there need to be at least 3 symptoms present in the following list that I'm going to provide here. So at the top of this list is a difficulty with concentrating. So there need to be 3 things present, just as we mentioned, of this list. So it would be difficulty concentrating and inability to focus on what needs to be focused on, feeling fatigued for no clear reason. Anxiety is a very exhausting thing. Anybody who's had prolonged anxiety can tell you how tiring it is. Another symptom would be feeling of impending danger or panic or doom, increased irritability, feeling of nervousness or trembling, a sense of restlessness, sweating. That can be sweating across the forehead, sweaty palms, intense feelings of of uh, muscle aches and just tense feelings in general, and sleep disturbance. There can also be something called an autonomic response to anxiety. It's usually more so experienced with people who have panic attacks, but certainly sweating falls into this as well. But autonomic responses would be a change in blood pressure, heart rate. These are all usually increased, rapid breathing, which often can lead to hyperventilating. So those would be some of the physical symptoms that someone might experience with an increase in anxiety. Sorry about that. So general types of anxieties that we see in different situations. So in a school setting with academics, some of the worries about grades and homework are things that we see for patients who have some generalized anxiety, keeping up with schoolwork. In the academic setting, sometimes there's a fear of being bullied or of being bullied, actually being bullied. Concerns just in general are sometimes with transitions to independence. So I think oftentimes of a transition to middle school, a transition to high school, a transition to independence, like going away to college or getting a job or moving and living on your own. Some of the general social anxieties that our patients experience could be a fear of hand waving in public and being singled out for their hand waving, for wearing sunglasses and maybe being the only person, say, on the playground who wears sunglasses, or of wearing hats when they're the only person out at the event wearing hats and worry just about being singled out. And also specific phobias. Remember, I mentioned earlier, one of the types of anxiety is something called specific phobias. And so it's not uncommon for our patients who have generalized anxiety disorder to also have a slight fear sometimes of things like having lab work done or EEG monitoring, or just having to go to the hospital. So what are some of the things that people can do to take care of themselves who have generalized anxiety? So being certain to get adequate exercise. Exercise is a great way to get rid of anxiety, to get rid of sort of that core anxious energy that people experience. Getting good nutrition. Sometimes people will say that if they eat too much sugar or food that just has too much sugar or is too high in carbohydrates, concentrated carbohydrates, that they feel like they're going a million miles an hour. So good nutrition is important. Adequate sleep is important. Avoiding an oversaturation of visual inputs. So this includes binging on TV or playing video games too long, or being on social media and all of the influence that social media can bring on. So listening to music is something that can help to calm someone. Being involved in crafts, especially if a person has hobbies and is interested in whatever that is, wood carving or putting together putting together cars and planes, models, all of those kinds of things. Needlepoint, needle crafts, the list is endless. And also reminding yourself that you can only control the things that you need to, controlling what you can control is what is really the primary focus. You can't control everything, but you can control yourself. So we often say, focus on controlling what you can control. So it's important to remember that anxiety is everywhere. Anxiety can be what motivates someone to wake up in the morning and get going, and that can be a positive anxiety. It's normal to be anxious and have a little bit of anxiety before some kind of performance or before a test for it's really important to remember that anxiety is felt by everyone. For young children, first being separated from their parents and going to pre-K and kindergarten and first grade, those are all milestones, but there are also moments when kids experience anxiety, and that's normal and it's to be expected. So when we think of anxiety, it's always very important to think about, should my child be experiencing some degree of anxiety in this situation? Is it typical in terms of development and where my child is and their specific development? So it's important to be sure to stop and think about that. For adolescents, as I mentioned earlier, the transitions to school, middle school into high school, and figuring out, the trajectory that they're going to be on post high school with graduation, whether they're going to college or they're going to work or they're going to take a gap year or whatever it is that they're going to focus on. Those are all very big transitions, and it's to be expected that there is going to be a little bit of angst and anxiety. So before seeking professional help, it's important to think about how to assess whether what you're seeing and hearing from your child is of concern. So the more parents can talk to children about their worries, about their fears, about what's going on in their life, the more they're in communication with their child, the better they're going to be positioned to support them. Also, being in touch with the school and understanding what's happening with your child's school, no matter what age, is significantly important, because what you're seeing at home may be different from what they're seeing at school and vice versa. For younger children who are less articulate and are not able to talk about how they feel, it's good to try to understand what their behaviors are telling you and what their behaviors, what they're trying to convey to you through their behaviors, so that you can interpret them and understand, and also to advocate for them. And it's critically important to be in communication with schools so that you can know what's happening there as well. And if the school is trying to support your child with doing something, it would be good for you to try to, if possible, to implement the same thing at home and vice versa, so that there's a lot of continuity, especially with less articulate children. So there are all kinds of ways that you can support your child. And one of those ways is to really be in good communication with them. However, understanding their behaviors, or, to be talking and knowing their friend groups and knowing the people who are important to them and knowing what their worries and concerns are, and figuring out ways you yourself can help to alleviate some of those worries. So what are the best treatments for generalized anxiety disorder? The first, of course, is to talk with a a mental health provider if you're concerned. Sometimes just getting a consultation with someone with your child. Um, um, I see patients here in our program, as does my colleague, Emma Bowman. And sometimes we first will just talk with parents without the child present, especially if the child is younger. And we do a lot of just supporting parents to help their child without ever needing to see the child. And sometimes we bring the child in as well, and we might just see them a few times is all that's needed. So just because you do consult a mental health provider, it doesn't mean that your child is forever going to be needing to see that person. But it can also happen that some interventions are needed beyond a few first visits and the consultation. And that could include things like cognitive behavioral therapy, dialectical behavioral therapy, or sometimes something that's called ACT, which is acceptance commitment therapy, and play therapy. So these are all some different kinds of therapies. I encourage you to look these up. Cognitive behavioral therapy is thought to be the #1 treatment for anxiety disorders. So that's the reason I list it first, and it's usually our main go-to treatment because it can be very helpful in terms of behaviors, literally behaviors, but it can also be helpful with distorted thinking. Thus the name cognitive behavioral therapy. And if seeing a therapist over like 5 or 6 weeks doesn't seem to be helping, we sometimes will refer patients to a psychiatrist for a medication evaluation. And again, just because your child might see a psychiatrist, it doesn't mean they're going to be on medications forever, if at all. It may turn out that the psychiatrist thinks that just more therapy will be helpful. Maybe working a little more closely with the school might be helpful. And then maybe the psychiatrist will recommend seeing the patient in a few weeks for further consultation and reevaluation. And maybe medications will be considered at that time. But it's important to know that just because your child sees a psychiatrist, it doesn't mean they're going to be put on medications and or be on medications forever. So some of the things too that we recommend are called mindfulness practices. And these are practices that are really becoming quite common knowledge and are widely used. So meditation is very common. It can even be used for young children. Exercise and yoga are very good. As I mentioned earlier, exercise is very good for helping with anxiety. Yoga is extremely good. We highly recommend yoga classes for patients. There are other things that can be used, such as progressive relaxation, which is where a patient, say, lies down and focuses on tensing and releasing their muscles, starting at their toes, and works their way up their body. Oftentimes, by the time they get to their knees, they're either asleep or they have really significantly relaxed. Visual imagery is also something that's very common. It's used a lot in sports psychology. Visual imagery is about focusing on something positive, on an image or an experience that was very soothing, and a situation or experience that where the person felt really safe, and they visualize that experience in all the senses. It can be a very, very calming thing. Mindful breathing is also very common. So that could be deep breathing, or it could be literally mindful breathing, which is just focusing on breathing calmly, and thinking about your breathing and literally sort of like meditating on your breathing. So these are all practices that you can look up and get more information on, and I certainly encourage you to do so. So when I mentioned mental health clinicians earlier, there are 3 types of mental health clinicians outside of psychiatrists, of course. So they are licensed mental health clinicians, psychologists, and social workers. So licensed mental health clinicians can provide therapies, as I mentioned earlier, and they can also refer patients for medication consultations. Psychologists do those things, as well as psychological testing, depending on the type of psychologist that's seen. Social workers do all those things. They don't usually do testing unless they have special training in that, and they often are known to be liaisons to schools and communities. So that is something else that they do. That's that licensed mental health clinicians can do as well, but social workers just have a longstanding reputation for that. So if your child needs to see a mental health clinician, it would likely be one of those 3 types. And if your child, if you think your child could benefit from seeing someone, you should certainly call our office. And as I mentioned, my colleague Emma Bowman and I, we would be very happy to see your child. So I've added this list of resources. These are some very significant materials that I think are helpful for parents and some for children. So there is a book called My Anxious Mind that's about 6 down on the list of books. It's a teen's guide to managing anxiety and panic. It's a wonderful book. It's a really quick, easy read, and it can be very helpful for teens with managing anxiety, and gives some practical advice and talks about distorted thinking that we all get into. And it just is a very helpful book. I also mentioned under the list of books, the last item there is an article that was recently in the New York Times, the New York Times Sunday magazine, and it's called "The Mental Health Crisis Among American Children is Real, but the Pandemic is Not the Only Reason." So it's not specifically talking about sunflower syndrome, but it is talking about anxiety in general. And I thought it would be a really good article to look at for you because it normalizes anxiety, and it can just be very helpful in understanding what's going on for your child right now. I've also listed 4 different websites here. The childmind.org website is a wonderful website. It's alphabetized. You can look up, whatever is of interest to you and checking out, and they have some very short articles that are immensely helpful. Lives in the Balance is another great website. It's from Ross Greene. He's a psychologist at Harvard, and he wrote a number of books, primarily The Explosive Child, but he offers a lot of insights into what's normal anxiety and what's concerning anxiety. Mass General Hospital's claycenter.org is another very good website. And I mentioned a website at UCLA on the bottom, which is also very helpful. I'd like to thank Donna Bolourchi for her help with this presentation. And I would also like to encourage you to look at Emma Bowman, my colleague's talk as part of this presentation. And she talks about accessing help with mental health issues, how to do so, how to go about, what the process looks like, and offers a number of suggestions. So I encourage you to look at that. Thank you so much.